Thank you very much, Sue. What a lovely introduction. And I know where you said earlier that you loved doing postnatal care when you were a frontline midwife. And that's lovely to hear. Obviously, I never have been a midwife, but I do feel that would have been such a wonderful time, especially if you've been able to offer continuity of care to the woman you've cared for during pregnancy, and then see the baby come out and see the two being cared for together. That seems to me a lovely thing to be doing. Anyway, let's get on to my screens. There we are. I hope you can see my title, Who Cares About Postnatal Care? And Blood, Sweat and Tears, Mothers' Bodily Fluids and Patriarchal Distaste for Postnatal Issues. I'm going to start quickly with a real story from a friend of mine who had two babies around the same time as I did, quite a few years ago now, but I don't think much has changed. She told me in the first few days of her first baby's life, she was home from hospital. She was asleep at night, but woke to hear the baby crying. She went to pick the baby up and sat down in a chair to feed her little daughter. She started feeding and the milk was coming out all right, so that was good. But her other breast started producing milk, so she could feel that wetness down her front. The baby, while feeding, as often happens, decided to have a really big wee and started leaking out of the nappy. So there was a bit more dampness on her lap. As again often happens in the early days, when you feed, the uterus contracts and you lose a bit more of the blood and lochia that comes out at that time. Another thing that happens sometimes with a feed is a little bit of a hot flush. So she started sweating. All these bodily fluids, and she was beginning to think this means an awful lot of washing and probably new clothes and new bed making tomorrow. And felt like bursting into tears, and then thought, I don't think we can cope with any more fluids here, and managed to hold those tears back. But I'm wondering if these ring any bells with people I'm talking to tonight who've had babies or cared for women at that quite intimate time and heard about very similar stories. So I've taken you back. Look, where are we? 280 years. This is a lovely German etching, great detail there. It's called Lying In After Childbirth, and it's talking about the uncleanliness of the mother after giving birth, with a quotation from the Christian Bible, book of Leviticus, if anyone wants to look it up. Stating that a mother should be considered unclean for 40 days after giving birth to a boy and for 80 days after giving birth to a girl. Tonight, I'm not going to be going into that difference between a boy and a girl, though we might want to wonder why. But what it does show is the woman looks though she's in a tent or she's in a special place. She's being visited by women. She's still in bed after some time and food has been brought to her. There are children around, but she's not in public and there don't appear to be any women around. So those 200 or 300 years ago, we're looking at a number of themes that seem to be reflected elsewhere. I acknowledge quite superficially at some literature from a number of other faiths, looking around these themes about impurity or uncleanliness or care during a pollution period, which were the words used looking at Hinduism. In some Jewish communities, women visit the mother 4 to 6 weeks after childbirth. Mother would be in a special room. It mentions sitting in a decorated triangle, which I find quite intriguing and I'd love to see a picture of. But the point is that there's a certain amount of her being set apart and special. More about seclusion and uncleanliness is mentioned in some of the literature in Islam for Muslim women. And in Christianity, certainly in Europe, there's been a ceremony called the churching of women after childbirth, originally to do with purification, these days looked on much more as a blessing on the mother and baby. So I've written here, these notes will not refer to everything that's happening these days, nor by all followers of those faiths. But what I want to highlight is the themes of impurity, of seclusion away from the public, and women looking after other women in their early postnatal weeks. And whether we are still keeping these in our heads and what people's reactions are to them, I think there are some quite significant thoughts to be had about why postnatal care is the way it is today. Here's a contrast. According to the media, and these sort of pictures I think will be pretty well known to many of you, I've put duchesses are not unclean and they don't merit seclusion. The Duchess of Cambridge here, and that's after her first baby, is managing to look gorgeous and very happy, which is great. But you'll see that the media focus is on what she's wearing, whether it refers back to what her, the late Princess of Wales wore after Prince William's birth, and so on. There is nothing here about seclusion or uncleanliness. Her lovely dress looks as clean as maybe, though I really hope she went home and took it off and got into an old pair of Jim Jam straight away. So, we've talked about these issues, and their seclusion was obviously thought to be quite a good thing, as long as there was contact with people who could provide care and provide some of the wisdom from perhaps older women who'd had babies themselves. What happened over the last couple of years? We had a COVID-19 pandemic. New parents were isolated from their family, friends, and other contacts they may have made during pregnancy. And at the NCT where I work, we had a huge amount of really distressing feedback from new mums who were unable to make use of those contacts, see their family or see their friends. And particularly among other problems, they didn't have those intimate conversations with other new mums where they could talk about these bodily fluids that we've already talked about. Were they losing a lot of blood? Were they able to have a wee when they wanted to? Were they sweating a lot? How was the milk coming in? All the things that are messy and intimate and not always easy to talk about, except when you're talking to your peers in those early weeks. What we were able to do, fortunately, at NCT was organise a lot, 50,000 plus, of walk and talk groups out of doors where women were allowed to meet and to a certain extent able to have those conversations, which were really welcomed and described as a lifeline by many women. I've put a lot of words on the next couple of slides, and you probably won't be able to read them all. But you can see, I hope, what I'm doing here is looking at, in much more detail, at the fluids that I've been referring to. And this first slide talks about the blood, the sweat, and the tears, obviously a well-known phrase, but perhaps surprisingly significant. On the left-hand side, there is information basically saying that losing these fluids is normal. There's a lot of variation on different websites about how much you may expect to be losing blood or crying. It's normal to have the baby blues. It's not normal to be unable to stop crying, and that's a sign of postnatal depression. My column over on the right-hand side is looking at when loss of these fluids is not normal, and there's some very significant risks of primary or secondary postpartum hemorrhage with too much blood. The RCOG says you may need to go to hospital, you may be given antibiotics through a drip, you may need an operation. There are considerable risks. Too much sweating could indicate an infection, and those are quite frequent. Not always very serious, but the most serious is sepsis, something that must not be missed. And tears, of course, can mean postnatal depression, another thing that is quite common and responds well to treatment. So women need to raise those concerns. I've gone on here. Again, I'm not going to go through everything here. There are many other fluids not often talked about. Nobody really wants to hear your stories about urine, vomit, and pus, but they are significant when either you can't pass the urine that you need to in the early days, or later on you may find too much is coming out when you're not expecting it. Signs of incontinence need to be treated. Vomiting, I was surprised by this, but I was looking it up. Vomiting after the birth can be a sign of preeclampsia, which can develop for the first time in the first 4 weeks. Not, again, insignificant, needs treatment, needs attention from a healthcare professional. Pus oozing from a womb, a horrible thing that nobody really wants to see or to talk about or to smell. But when it's a sign of infection, you need to get treatment again. I looked at the National Maternity Audit. 4.4% of mothers are experiencing unplanned maternal readmission to hospital, and most of those are because of a surgical site having a wound infection. Does not want to be left untreated there. But of course, going back to hospital is very disruptive, very worrying and unpleasant. I've added in breast milk and colostrum. These are good things to have if you're planning to breastfeed, but of course, not enough or too much in the early days can be worrying and or inconvenient. So these are anxieties for women during their postnatal weeks. Very briefly again, some of the very many comments from women during the COVID-19 pandemic, women experiencing poor mental health and feeling deeply anxious, not felt supported, feeling the system had completely failed them. Some really, really worrying feedback. Others who just hadn't had any care at all, had managed to fall through the safety net of all kinds of the different people providing postnatal care. And another very sad story from women who'd had a cesarean section. We do 200,000 of these every year these days. Nobody seemed to know who was going to take her stitches out. I found this very depressing, that she had literally to walk from pillar to post, GP surgery, hospital, couldn't get unconflicting information about it, and eventually the nurse at her GP surgery did it. Should not have to happen. Because we have a lack of quality in postnatal care, and I do not find many people arguing against that. This is an old bit of a conclusion, but again, it's very commonly quoted: the principal dimensions of quality care, safety, effectiveness, and being person-centered, woman-centered in this case, we usually say. Is it safe? Well, a lot of postnatal care is safe in that the woman survives, but unfortunately, where there are maternal deaths, low numbers of them, thankfully, but not reducing over the last few years, and about 70% of them occur in the postnatal period. We will not reduce those deaths in the national safety ambition until postnatal care improves. We know it can't be effective. Very little is audited, very little research is carried out into the whole postnatal service. So we don't have up-to-date evidence of what exactly it should be. It's clearly not found to women's satisfaction. Every big survey finds that it's the least satisfying part of the maternity journey for women, and mainly because of the fragmentation. Midwifery care is handed over from the hospital to the community, is then handed over to the health visitor, and somewhere around the 6 to 8 week mark, women should get, and it is funded and it is mandated, a check with their GP, but they still don't all get it. And some of them fall through a gap. This is a quote from Professor Marion Knight of Embrace UK, where they hold confidential inquiries into maternal deaths. And Marion's repeated conclusions over many years show that what we are not providing for women is joined up care. There is a lack of responsibility and accountability. Care is not being coordinated. And that's why she says, mind the gap, because it can be absolutely tragic when people fall through. That was a rather downbeat slide, and not surprisingly talking about maternal deaths, which are always awful to read about. This is nearly my last slide. I'm going back to that rather depressing phrase about postnatal care being called the Cinderella service. And my call is to get Cinderella into the palace, because that means postnatal action. It needs leadership, it needs accountability, it needs continuity, and of course, like every part of the service, it needs equity, so that every woman gets the care she needs and can become the parent that she wants to be. Thank you very much for listening. It's been a pleasure to be here tonight. Thank you.